show you how I would take a patient's blood pressure, a two-step manual blood pressure in this video. Before I do this, what I want to obtain first is the patient's baseline, their medical health history, and I also want to make sure that the patient has been relaxed and resting before I do this. You don't want to take a manual two-step blood pressure when the patient just went for a walk or they just had a stressful exercise period. So this is what I would like to do first. So what I'm going to obtain is my blood pressure cuff here, my manual blood pressure cuff. I'm going to also grab my stethoscope. Before I do this, I want to do some hand hygiene. And then what I'm going to do is I'm going to feel for the patient's brachial artery. So first I need to feel where their arm and their elbow bends, okay? And then I'm going to feel for their brachial artery. And it's usually kind of towards the patient's midline, right where, okay, so I found it here. So what I'm going to do is do my estimated systolic blood pressure. When I find that, I'm going to look at my blood pressure cuff, and the point where it says artery mark, that's where you want to place it against the artery, the brachial artery that you just felt. Okay, so I'm going to align it with my patient's artery right there. And then I'm going to wrap the cuff around my patient's arm. Okay. You can have it over clothes. I just find it a lot easier to put it under my patient's clothes so I can hear it a lot better. Okay. So what you're going to do is you're going to feel where their artery is, and what you want to do is inflate the cuff so that you are not able to feel that pulse anymore. And that's your estimated systolic blood pressure. So I'm going to turn this dial towards the right side, okay? And I'm going to inflate this until I can't feel it. And slowly deflate. Okay, once I know that I can't feel it, I'm going to remember where that number is. So for this patient, it was like 130. I'm going to go 30 millimeters of mercury above that. Okay. So now that we've deflated it fully, what we want to do is give them a bit of a break because it is quite uncomfortable to have your arm squeeze. So what I do is I give them a minute or so to have their circulation back into their arms, and then I'm going to do my second step. So this second step requires similar things where you're going to wrap the patient's blood pressure around their cuff, around their arm. Okay, and then what you can do is use this little hook to place it on top so you can see it a little bit better. And then now you're going to use your stethoscope, and you're going to place this around your ears, and you're going to use the diaphragm to listen to the brachial artery this time. And what we want to do is have your stethoscope on the patient's arm and have your blood pressure valve here in the other hand. And then you can look at the dial, okay? So I'm going to close this off here, and I'm going to turn it on. I'm going to go to 160, and then I'm going to slowly deflate and listen for the first sound. Okay. And as you deflate, note where the last sound goes. Okay, good. So now I have 110/60 as the patient's blood pressure. And what you want to do is deflate it fully, remove this off, and take this off the patient's arm. Take the cuff off, and then you can cleanse your equipment with alcohol and antiseptic swabs. Okay, so thanks guys.